One of the things that I want to talk about, because people have different practices. So I have 496 optometrists that refer into my practice. That's where the DRSplus is going to come into play. It's a little less expensive, but it's going to give them what they need. The reason I'm more of an Eidon person is because I get that full 220, and it allows me to see out the periphery without having to dilate these patients, where maybe an optometry practice is still dilating for some reason or another. Maybe they've got a pediatric patient that really need a cycloplegic refraction to do, better glasses. But I think my transition from the DRSplus to the Eidon, it's been beautiful. I mean, I don't want to say anything bad about the DRSplus because it's a phenomenal screening tool. But the Eidon has given me a lot more pathology that I can't even see with my indirect, and I'm pretty decent with an indirect. I think that you have to figure out what's economically affordable, so the DRSplus works. I mean, it's a great screening tool, and that's what we use it for. But the Eidon is really what I need in my surgical practice, because most of my patients are what? Myopic patients that are coming in, they can't wear their contact lenses anymore, and they want LASIK.